Hello, everyone. You're very welcome to this webinar from Mid West ARIES in partnership with Mental Health Ireland. My name is Margaret Keane and I am the Education, Training and Development Officer here. Today, we're going to be talking all about innovation and change in mental health services. This is one webinar that we've really wanted to run for quite some time because we get the benefit of meeting people all across the services and in the community who are doing really interesting things. Sometimes the general public can't see that. So this is an opportunity today to do a deep dive on that. Before I introduce you to our panelists, I just want to go through a little bit of housekeeping just to tell you what's going to happen today and what it's going to look like. So we're going to be here till 3 o'clock. So I hope you stay with us. As usual, and for anyone who's attended our webinars before, we do love to hear from the audience by putting questions in the Q&A. So if you're unsure of how to do that, just if you look to the bottom of the screen, there's a navigation bar with a Q&A button. Just open that, type in your question and submit. I'll see that and hopefully put it through the panel. So without further ado, oh, just a reminder actually, we will be recording this session. It's being recorded as we speak. And you can share that with people that you think might be of interest next week when we have it up on our YouTube channel. And we also have it as a long form podcast called The Wellness Panel, which is available on all good podcasting platforms, including Spotify and Apple. So without further ado, I will ask all of our lovely panelists to open their videos, please, so that we can see everybody. Lovely. That's great, and I am delighted you all can be here. I'm just going to give you just a brief overview of who we've got today. So we have Mike O'Neill from Mid West ARIES, my manager. I don't think Mike's missed one webinar, and I think if we did, the sky would fall, but it's great to have him here. And Mike will be talking all about recovery education. Delighted as well to welcome Rosemary Ryan, who is the area lead mental health engagement, and Michelle Hannan. Michelle, lovely to have you, who is the social prescribing link worker working out of Paul Partnership and really interested in that. I'm dying to hear all about social prescribing. And we also have Stephanie Moloney who is an OT or an occupational therapist from St. Anne's Community Mental Health Centre. We then also have, and thanks Stephanie for joining us, Claire Flynn. Again, Claire, you're a stalwart for us. We couldn't run these without you and the support of Mental Health Ireland. So lovely to have you here. So yeah, so what are we going to talk about today? Well, look, in the past 5 years, you might think that things have, that there's been challenges in the mental health service, and of course there have been, but there's also been some great innovation and change. And in fact, Mid West ARIES has been part of that change with a shift towards a person-centered or more person-centered approach to treatment and support. All of these panelists today, as you've heard, have worked right across all the services and in the community. And this is our opportunity to learn what is actually happening on the ground, things that you might be surprised by. So to hear what's happening now and what are the mental health services going to look like in the future. Now, we have 6 panelists and we've got a lot to get through. So I'm going to just get to it rather than me chatting. So let's start with a proper round of introductions. So I'd ask each of the panelists, can you tell me a little about your organization or your service and your role in it? And Mike, I'll probably go to yourself first, if that's okay.
Yeah, great stuff. Thanks, Margaret. And yeah, so I'm the manager with Mid West ARIES. We're the recovery education service here in CHO3. That's what we call it here, community mental health or community healthcare organisation in the Midwest, and that makes up Limerick, Clare, and North Tipperary. So again, yeah, we're up and running 5 years, and that's what we do. We bring recovery education to the community. We do staff training. We run webinars. So again, it is about that person-centered approach and involving, our community partners, staff working in the services, people who use the services and their families who support it. So it is that collective approach. So yeah, it works. That's the main thing. So yeah, thanks, Mark.
Thanks, Mike, and thanks for that. And Rosemary, I might come to yourself. And again, just in terms of our audience, if you have panelists kind of coming in and out, you have to understand sometimes IT issues can come to the fore, so that they'll come back in. So Rosemary, might come to yourself on that point. So tell us a little bit about your service and your role in it.
Yeah, thanks, Margaret. I just got bumped out of the meeting, but it came back straight away anyway. So I am newly in as the area lead for mental health engagement, and for the Mid West area, that's Clare, Limerick, North Tip. And in my role, I'm responsible for making sure the voice of people using the services, family members, carers, supporters, are heard. So as part of that, I am on the local and area Midwest management teams. So as I said, I'm responsible for ensuring that any key decisions about service delivery or new initiatives are fully informed by the voice of service user, family member, and carers. And I probably joined myself as one of those family member interests. So it's great to be in this role and be able to ensure that, as I said, voice is fully heard.
Thanks, Rosemary. And it's such an important role to have that voice represented. And I don't think people are aware that that's there. So thanks for coming along today, just to let us know what that service looks like. Stephanie, I might come to you again. I know you just had a couple of connection issues, so I don't want to lose you just yet. So if you just want to just introduce yourself and the service.
Great, thanks, Margaret. Hello to everybody there. So yeah, I'm an occupational therapist. I'm based in one of the community mental health teams, so currently based in St. Anne's community mental health team. I suppose, what is occupational therapy? Occupational therapy is a healthcare profession concerned with promoting and supporting people to do the things that they need to do and that they want to do, and as well as what they're expected to do. Occupational therapists work in all sorts of healthcare settings, not just mental health. Mental health is just where I'm based now. And really it's looking at how any mental health condition can impact on function, and really supporting people to do those things that are meaningful to them, either as a means or an end of therapy, that we can use those occupations as a means of therapy, but most importantly as an end of it, as well as an end goal. So I suppose I'm talking today on behalf of a wider occupational therapy department, as there's occupational therapists working in, I think, nearly all the community mental health teams, as well as the inpatient unit in the Midwest, which is great.
Brilliant, Stephanie, and thanks for that. And I think, again, people hear of OTs and they kind of, oh, what does that actually mean? What does that do? So it's really great to have you here. Claire, I might come to yourself next, if that's okay.
Yeah, of course. Claire Flynn. I'm the Development Officer for Mental Health Ireland in CHO3, which is Limerick, Clare and North Tip. And Mental Health Ireland, we're a national volunteer organisation. We're actually the oldest mental health charity in the country. We have that distinction for a little while. It was established in 1966. But what we do is we promote positive mental health and well-being to the communities that we work in. And we do partly do this through mental health associations, which are usually made up entirely of volunteers. And we actually have one of the strongest regions here, that we have 10 mental health associations in this region. So quite a lot of volunteers in their community promoting positive mental health through Mental Health Ireland and through the associations as well. So that's what we do.
Brilliant, Claire, and great to have you here. And this, again, talking about what's happening at kind of ground roots at the community level. So brilliant. John, I might come to you next, if that's okay.
Yeah, hello, hi, how are you doing? Yeah, my name is John O'Connor. I'm the therapeutic and recreational coordinator here in the acute psychiatric unit in Ennis in County Clare. So I work here in the recovery and wellbeing unit. And I suppose myself and my colleague Kira, we put together a kind of comprehensive program for a kind of like an activation program for the service users here in the hospital in this unit. And I suppose the kind of the aim of the recovery and wellbeing unit is to create an ethos of one that's kind of, you know, that's recovery orientated and person centered, and it just helps kind of support, you know, in enhancing the service user care here in the unit. I suppose we kind of aim to provide a range of therapeutic and social and recreational activities, which we hope are kind of relevant to supporting the unique and individual needs of each person that we work with here in the unit. So we would facilitate and co-facilitate classes ourselves here in the unit, and we would also have support from external facilitators as well, such as social workers and psychologists. occupational therapists, and peer support groups as well. And we also have support from peer education groups like ARIES, and we recently would have the Irish therapy dogs come aboard with us as well. So yeah, we would, I suppose, yeah, that's kind of pretty much kind of what we do here in Ennis. Yeah.
Thanks. Gosh, there's a lot going on in Ennis, and we know that because obviously Mid West ARIES are there. We're there twice a week delivering our recovery education workshops there, and again, couldn't do it without the support of John and Ciara, and it's just one of the most positive things. I think if you talk to people kind of outside the service and they think about psychiatric units, they're kind of focused on the meds a bit, you know, the clinical recovery piece, whereas this is just, as you said, person-centered, and it's just fantastic to see. And as Mike says, it works. So thanks, John, for that. And Michelle, last but by no means least, dying to hear about social prescribing.
Okay, no pressure. So thanks, Margaret. And I'm delighted to be here. So my name is Michelle Hannan, and I'm the social prescribing link worker for a new project that launched there in May under the HSE Sláinte Care Healthy Communities project. So at present, I am the sole social prescribing link worker for the Limerick City area. And what social prescribing is it aims to connect people with sources of support that are very low cost or free out in the community, that are accessible to them, with the overall purpose of improving their health and well-being. And that can be anything. It's different things for different people. It's a very individual, personalized, flexible approach. And my role in that then is I would work closely with those referring in, so people can self-refer or they can be referred in by a medical professional. I'd work closely with those referring in. Then I work with the client on an individual level, and they can avail of anywhere between 3 and 12 sessions where they meet with me on a one-to-one basis. And then I would work closely then with the community and voluntary sector across Limerick to find the activities and support that best suit the needs of that individual. And it doesn't stop there then. It's not just signposting, it's more of a supported access. So after the person comes up with their personalized health and well-being plan, then we look then at what barriers that might be present for that person in engaging with something that they'd like to do. And I'd work with them through that, and then support them then as they engage with the service, follow up with some phone calls, meet with them again, and I suppose really see if they're enjoying it. And what I find that is very important is letting the person know that they can come back if they're not enjoying an activity and say that wasn't for me, and then we look again at what might suit their needs better. So as I said, it's a new service. We started in May. It's going very well so far. We've had great support from the community and voluntary sector across Limerick, and hopefully it'll continue to grow.
I have no doubt, Michelle. It's just so great to see that finally here.
Yeah.
You know, in terms of social prescribing, and I suppose that's the niceties over. We've all had our round. We know who's in the building, as it were. And now let's get to the meat of it. So, what do you think? And I'm just putting this out to everybody. What do you think is the most innovative thing about your service or your organisation? How is it improving the lives of service users or ordinary people? So who'd like to come in on that one first?
I might come in just there on social
Brilliant,
prescribing, Margaret, just because
Great.
It's new. And I suppose for me, I've worked out in the community and voluntary sector in Limerick for the past 17 years. And for me, social prescribing is really getting to the people that are not the people that would just turn up to a community centre and say, what do you have going on here? So it's really been that link. That people can self-refer, but also that link between the medical world and the community and voluntary sector, and that real supported access. And I suppose that real individual kind of flexible approach then to the service. And because it's so individual as well, it's so broad in that it really is based on what people are interested in. It could be anything from walking to nature, to creativity, to singing, to dancing, to music lessons. It's whatever makes that person happy, brings happiness into their life, and I suppose sparks a bit of joy for them.
Absolutely, Michelle. And again, what I'm hearing really from everybody, particularly, even Stephanie and John and Rosemary, is that person's, and obviously recovery education, that person-centered approach and how important that is. And I think that's really, for me, kind of looking the outside in sometimes, is that's the kind of key change. I don't know if anyone else agrees with that, or again wants to come in on the innovation piece, Mike.
Yeah, I'll come in on that. And I suppose ARIES itself is innovative. And so it's a bit like, it's how we engage. It's like Michelle engaging with people. It's like Claire engaging with people. Very often it's building that bridge or the relationship, from the clinical world out to back into the community and supporting people in that process. And I remember before Mid West ARIES existed, I heard about this new initiative, setting up of recovery education. But again, so when people talk about the mental health services are not listening, they went out and surveyed what people wanted in CHO3. And this was one of the things that were on the list. And so to have recovery education for people, like as John said, to support people in their personal recovery. And I know we're underpinned by research, and that the main model we use is called CHIME. But for me, I suppose going back to the time when I was using the services, and as a service user, I had to figure all this stuff out on my own, whereas like the more stuff there is like this, like where it is about being innovative, it can help people in the recovery journey and make that recovery journey much faster. Therefore, there's a cost benefit to all of the services, and it just makes sense because I know everything that we do and what everybody has said here. Well, I'm evidence that works, so before you go outside and ask other people, so, and again, when you look at, if you go back to January 2020, I bet none of us were on a webinar panel. I never even heard what Zoom is. So even when you look at, even through challenges, like there was benefits of challenge because it forced us to look at, how we can communicate in a different way and enhance the type of service that we're doing and make it available and make, like today, even making that information available to people across the community, who may not be in a position to walk into a workshop, a one-off thing like that. So again, it is about having those hybrid models as well. So there's lots happening. And I think even on Friday, we were talking about, God, we could have another one of these innovation webinars on Monday, because we have a list of people who said, God, I'd love to be on that, because this isn't everything is happening. There's loads of stuff happening. We could fill another 2 panels with ease. So I better give someone else a chance. Thanks, Margaret.
No, absolutely, and it is. It's just there's so much. Claire, did you want to come in there, or
I
Stephanie?
did, because I felt that, because I think what I really there have been so many innovations, and I think for me anyway, what I see is that over the past number of years, there's been a really concerted effort to have the service user, the family member, the supporter's voice to be involved in these decisions. And so many of these innovations are coming from people who themselves have been advocating for either themselves or the people that they love, or the people that they support, or the people that they've been working with in their community organization, to say, like, we need other things. You know what I mean? We need, this is what I think would work in the community. And, it's at the stage now where the community voluntary sector, the people who are accessing services, their supporters, and the statutory services are actually all starting to work together a lot more to come up with these innovative ideas, to make sure that there's funding there to do them, to make sure there's people there to carry them through. So for me, all of the innovations that we're going to be talking about, I think, comes from that sort of switch, if you like, of going just from the medical model, switching it over to having that service user and that recovery voice heard, like Mike's voice and everyone, and everyone else's voice here. Is just, that's been the biggest innovation for me. And from Mental Health Ireland's perspective, one of the ways that we've changed, and which is, is across many organisations now, is what's called the co-production model. It's a model that's been used in the community voluntary sector for a long time, but it's just been given, a name now in this way. And it's just that no matter what we do, the people who are accessing services, their supporters, and people who work in services from grassroots up to statutory should be involved in trying to figure out what's needed here, what's the best way to do it, and what sort of impact will it have, and will it have the impact that we want it to have. And then also another very important part is the evaluation part. What have we learned from it? What can we use in our learnings? And then those learnings are being applied again. So just in terms of all of that, I just see so much innovation all around. For me, it's really inspiring and it's really encouraging, for somebody who works within the sector as well, because like that, we meet a lot of the people on the ground all the time, people in their communities, like the volunteers in our mental health associations, want to be effective, want to try and support, and giving them these innovations and giving them these different things, give them a way that they can support themselves and their community at the same time. So I just feel very inspired by it all.
And it's great, Claire, I completely hear you because I feel the same thing. Mike just mentioned their meeting we had in Grow on Friday, and just meeting all these people who are doing amazing things in the community. And again, what I heard there, Claire, was the idea of this turning it around on its head. It's no longer top-down stuff. This is coming from the grassroots upwards, and we're meeting together. And this is a great example of this today. And our partnerships going forward. We couldn't do what we do if we weren't welcomed into the acute psychiatric services, both Ennis and 5B, and you know, with the OTs as well, Stephanie. And Stephanie, I might come to you if that's okay in terms of the innovative piece.
Yeah, I suppose there's a couple of things that people have mentioned already that struck a chord with me in terms of that client-centered piece and the co-production piece. I think occupational therapy is an old profession now. We're well over 100 years old, which people might not realise. But always, I suppose, that client-centered piece has been the core piece of our model, that we're always looking at about what's meaningful to the person and looking at how we can really promote function and someone's independence, be it looking at their routines, their time use, looking at how that influences or maybe has been impacted by their mental health condition, and how we can support that from an individual level, working towards, I suppose, what needs are identified, and can we, I suppose, really put together or produce groups, which have been, I suppose, one of our biggest pieces of work over the last, well, forever, I suppose, but really over the last while, for me, it's been one of the things that we've been most innovative in is having online groups. We identified a need, particularly during COVID, that people's, I suppose, whole routine was completely disrupted, and as a result that had a knock-on, you know, effect and impact on their general health and well-being. So we looked at, you know, how can we actually roll out online groups. We linked in with other clinical departments up in various different parts of the country about how we actually get this rolled out, and it's something that we've tried to continue. I know Margaret and Mike, you know, it's something I've put the connections out with you guys about how can we actually connect people to ARIES, recognizing that people won't necessarily always maybe go in person or even in their own session rooms at home, log in online. So we're actually facilitating that we can run the workshops here in St. Anne's, the online workshops. So it's, again, even just breaking down some of the digital literacy barriers as well. So that's been one of the real new changes that we've had going on recently. But I suppose all in all, it comes back to an individual need. And if a few people might have said to me or any of my colleagues, this is a need for me, how can we best meet that need in a time efficient way? And a lot of the time group work kind of can come back to that. But I think it's great to hear that everyone is kind of the same view around the client-centered piece. But it's definitely something that we've done work on, but we can continue and do more work on as well in the future.
I think what's brilliant, Stephanie, I love that, you know, your profession's 100 years old, yet it's still changing, it's still evolving. And I think part of that are the individuals behind that service, you know, being open to change, as you said, like reaching out to us, we reaching back and having those partnerships. And that's really exciting. And that's where real change, I think, is happening in terms of the mental health services, even in terms of what Claire and Mike was saying as well. Anyone else want to come in? Rosemary, do you want to come in there in terms of the innovation piece?
In front of you, John. Yeah, I just think the biggest innovation piece that I have seen is the consultation, where service users, family members, you know, that they're consulted. I would have been in the situation myself where you want to give feedback or you want to contribute or be informed, and it just, the avenue wasn't there. So peer support workers and family peer support workers are something that we discussed with previous area lead, gave our feedback on, and you just stated what a huge priority it was, something we felt was badly needed, and that's now in place. So the fact that we could be consulted about the services and that our voice is priority, I think, is obviously a huge innovation and so important. Absolutely,
Rosemary. And again, it comes back to that voice being heard, being listened to, and how that can impact really positively on the services right across the board. Again, just want to hit on that technology piece because it's been mentioned in terms of moving online. I know for us, Mike, it's been a huge opportunity as we've moved to hybrid learning and you know, partnering with both 5B and Ennis in the Understanding Acute Mental Health Services for families, carers and supporters self-paced course, and we might give you a bit of signposting on that later in terms of innovation. I think I've gotten to everybody on the innovative piece, but I just want to give a prompt. Oh, apart from John, apologies, John, go for it.
Yeah. Okay, sorry, no, I won't keep you long now.
You can keep me as long as you like. I love hearing about the recovery
yeah.
unit.
So, yeah, so kind of as you mentioned earlier, I suppose, Margaret, like, I suppose we work in the clinical setting here. And I suppose, a lot of the, the people that we'd be working with, the service users here in the unit, they would, they would be, there would be, a lot of discussion with the doctors around medication and things like that, and it'd be very much kind of clinical focused. So I suppose we kind of see our role really as, is to kind of, create a kind of a balance, like, where we're supporting the service users in helping to kind of helping them to see that actually there are things they can do, things that they can take control of in their own lives to help manage their mental health. And there's a huge element of, I suppose, kind of empowering the individual, and supporting them, through the different groups that we facilitate towards, helping them to kind of manage their mental health in a way that's kind of respectful to each of their individual needs. So I suppose kind of part of that, I suppose, is just around, we would kind of hold some kind of well-being groups, and we would see that people with I suppose with mental health issues, like would often experience kind of low self-esteem and low sense of self-belief in themselves, and maybe a low level of resilience. So we've started to introduce kind of self-esteem building groups around building resilience. We've had greater input now from psychology as well, and I suppose the psychologists really really kind of help us help the program in that we've been able to kind of facilitate and co-facilitate kind of DBT workshops. So these, I suppose, DBT kind of skills, I suppose, as dialectical behavioral therapy, I suppose they help us look at kind of, I suppose, practical ways and help educate the service user on practical skills that they can bring into their day-to-day life around, tolerating high levels of distress, regulating their emotions, even down to building and maintaining, interpersonal relationships, with their loved ones and people who support them in the community. So, as well as that, I suppose there would be an kind of, I suppose, an emphasis on that peer support element. And I suppose over the last, I suppose, couple of years now, and we've seen an increase in peer support, in the Midwest in mental health, and I think we're still awaiting a peer support worker to work here in the unit, in the NS unit, but there are a couple of peer support workers working in the community, and they have linked up with some of the service users here in the unit, and it's really kind of quite powerful what they can offer, just offering their own kind of lived experience, to help. It's a kind of a non-clinical role that just using their lived experience to help to be able to relate to the person, and to be able to help inspire kind of hope, that recovery is possible.
And I think, John, I'm so glad
we find that so rewarding, ourselves, like that we're kind of in that position, that it's more person-centered and less clinical focused.
Yeah, and I'm so glad you brought up the peer support workers element, because I think that's something definitely over the last couple of years that I think is going to gain traction, John. So it's fantastic to hear about that. I'm actually going to stick with you because I nearly overlooked you the last time, John. And I suppose you've mentioned a few things there, but what changes in the mental health services over the last few years, do you think people should know about or excite you? Now, you mentioned peer support is one, but is there anything else there that you think, you know what, this is something that it's worth knowing?
Well, yeah, I mean, I suppose when I think about mental health and supporting the service user, I suppose you really have to think about supporting the family member as well. And we have done a lot of work with yourselves, like with ARIES, around helping to put together kind of a resource pack or kind of a self-paced course for family members that they can access. So we have, through yourselves, kind of, I suppose we've kind of, you know, in fairness now, it is mainly yourselves now, the work that you have done, is kind of put together a kind of a poster, I suppose, that, you know, that family members can, you know, can log on to and link into a self-paced course, you know, so they can develop a greater understanding about what, you know, we would offer here, you know, in the acute unit setting. And, you know, it just helps to maybe break down any kind of barriers or any pre-existing concerns that family members might have about, you know, maybe how their loved ones are being cared for, and things like that.
And I think that one, I think, is a really good example, John, again, of partnership. You know, so if we lost somebody, no, sorry, we forgot. And I think Rosemary wants to come in on something there. Rosemary, if you'd like to just pop in.
Yeah, just John, I did take that course. It's online, self-paced, and just hugely informative for a family member. And, you know, I was, you know, delighted to have that information. I suppose the change that I see is the emphasis on recovery and recovery journey, that it's not a one day, or, you know, it's a process, and it could be a process that we return to. You know, we have ups and downs in our life, but that the recovery journey is something that we can get resources and supports for. It's been a huge positive change.
Yeah, thanks, Rosemary. Yeah, and just kind of, I suppose, kind of building on that, I suppose, as well as kind of, you know, working with the family member, you know, I suppose there has been a lot of work done as well, around the area of kind of, we say, discharge planning and that, and, you know, I suppose it's an area maybe that hasn't, you know, really been kind of explored too much, you know, in recent years, but definitely over the last few years, like, you know, through actually through this mental health engagement as well, and through areas that area of, you know, supporting the service user in that transition from, you know, their time in hospital to going back out and adjusting to community again, and just trying to support that transition, and kind of working with the, you know, community team, and having you know, that emphasis around involving the service user as much as you can, you know, in that discharge planning process, and helping them kind of set goals, you know.
Absolutely, John. And I'll just come in there for a second, because sorry for talking you over there. I think there's a little bit of a delay there in the connection, but I know Mike wants to come in on that very point.
Yeah, and I think John is bang on there around, like, kind of, I suppose, but that partnership where we done that course for Ennis, we're working on one at the moment, again, just to finish it, like, to be the same course but with a 5B version for Limerick City. And I suppose what I love here about working in ARIES, we're part of the mental health service, and I suppose from senior management, it's just positive risk take. Go for it, give it a go, because, like, this makes sense, you know. So we're swimming with the tide in it, but I think it's about that partnership approach. And another example, and I suppose when we look at linking in with St. Anne's and Stephanie, and kind of those ideas around, well, you've done that for the acute services. Wouldn't it be lovely to have something here that we can produce up in St. Anne's, which will become, like, you know, demystify what a community mental health centre looks like, and that could be shared with everybody, because, like, they all operate in the same way. Again, another piece then around the self-paced, innovative piece to develop, again, around, you know, help people prepare for their appointments, you know, and again, standalone stuff that people can access when they want it. Another one in the last couple of weeks, we had the conversation, again, joining the dots with Claire Flynn, and discussion around RAP, and again with the acute services in 5B, to create an introductory modules for the 6 different dimensions, that, again, if we can produce it for 5B and then if we trial it and it works, then we can give it to Ennis, then we can give it to the day hospitals and train people to deliver it. So it's about pooling those resources, working in a collaborative way, and it's co-production in action, as Claire said, bringing people together. And then when you get the buy-in from the start, you're producing something that will work and that people want. And that's what's key. And I think that's the difference. If I was to say, what is ARIES' motto? It's as simple as, what happens when you ask people? So there's no patriarchy, there's no top-down talk. We don't come with what the experts say, because we're all experts. Everybody is an expert, you know, and when you pool that expertise, then you'll come up with the goods. I see Stephanie's hand there again.
Yeah, Stephanie, if you come in there, just before you come in, Stephanie, I just want to give a prompt to the audience. This is your opportunity here. You've heard from, you know, people who are literally at the front line of change and innovation in mental health services. If you have any questions you want to put to them, please do now. Stephanie, if you want to come in there now, sorry for jumping in.
No, that's great. That's fine, Margaret. Just, I suppose, because a few people have mentioned there about transitions. I think that's something that I suppose in the occupational therapy department, we're trying, always have been, but are continuing to try to be innovative in that regard. And, you know, we do try and support people during those times of transitions, be it a transition from the inpatient unit back out to the community mental health team. So a recent example of that is now, thankfully, we have a new occupational therapy post in the inpatient unit now here in Limerick, which is a great change and so exciting. You know, we would have been covering from the community to go into the inpatient unit, but I think to have someone on site all of the time to meet people where they're at and in a timely way is fantastic. The other thing, I suppose, is, you know, we strive to make links with other services in the community to support people during those times of transitions. A recent one for me has been through to the disability office in UL. So again, just making sure that people are having a really supported transition from maybe not having been in education for years and now starting back in college. So I can give some amount of support, or indeed the team here in St. Anne's can provide as much support as we can, but there's also services available in UL that we can actually link in with and do regularly now to make sure that someone has a really positive experience of that transition. Because if that first stage of that transition goes well, the likelihood of that succeeding and maintaining that success going forward long term is actually much, much greater, no matter what the transition is. You know, we've spoken about UL and the disability office there. Another one might be with employability, and, you know, lots of links there in terms of actually supporting people back into employment. So we're trying to cover all of the bases, and you know, it'll always come back to someone's function. For me, it's the hat I wear. Are people doing the things that they need to do, that they want to do, or that they're expected to do? But we know that that just doesn't happen when you're sitting here in a community mental health team, or, you know, at base here on site. It happens when you're at home. It happens in your own workplace or in your own place of education, whatever it might be. So we're trying to be as active as possible in making sure that we don't miss out on any of those areas.
Brilliant, Stephanie. And I could just see Michelle nodding the head there and just agreeing with everything you're saying. You can just see the kind of crossover between services and having the same values. It's easy, as I say, you know, to work with different partners when you have the same values, really. And you can kind of see that there. Have a think, and if anybody wants to come in on that again, in terms of what's exciting you about the mental health service at the minute, not just even on your own services, but things like, Claire, for me, one of the big things for me is co-production. If you stick to that, you can't go wrong.
Yeah.
You know?
Yeah, and I think what I'm experiencing and what I'm hearing as well here is, you know, between Michelle has links now, you know, in her social prescribing role between people who might need extra supports and the community, you know, the community centres, the community groups, you know what I mean? All those different things that are already, you know, on the ground working. And then that links in, you know, that links in nicely with what Stephanie, what John are doing, what Rosemary's doing. You know, I can just see all the linkages, you know, all the time. So, you know, people aren't operating in silos anymore. You know what I mean? Like organizations, people are collaborating together. And it's like Stephanie was saying, it's all about, you know, that individual person. You know, what does that person need? What will work for that person? And even though we can't tailor everything to one person, but we can help a person to tailor what works for them to them, you know, what's already out there. So, you know, just, I love, I suppose, community collaboration for me is always, you know, where my sort of heart is, you know. So, you know, people have expertise themselves, people have strengths themselves. Sometimes they just need a little bit of extra support to recognize them, to see what they are, you know what I mean, so that they can have lifelong recovery, you know what I mean, not just when they're in contact with services, but that they can learn, you know, new things for themselves and new ways of maybe of supporting themselves and new ways of finding their joy, as Michelle said, you know, new ways of finding contentment and happiness in their lives, regardless of, you know, what is going on for them. You know, and at the end of the day, each and every one of us, I think, want to just try and be as productive and lead as happy a life as we could possibly can. And it's, I think, all the innovations that we're hearing about and all the people that are here today and all the other people involved in all these organizations as well, that's their purpose as well, is try to help people to do that for themselves and for everyone else as well. So I mean, one of the things that I love as well is that, you know, we're actually seeing it in education as well. Like, you know, you have the peer support course in DCU, you know, so anyone with lived experience can apply for that course, use their lived experience, and then, you know, learn ways of being a peer supporter. And like John was saying, you know, those roles are starting to open up across the country as well. You know, in many organizations now, Mental Health Ireland, Mid West ARIES, you know, and in so many areas that a person coming with their own lived experience, either as for themselves or as a family member or as a supporter, can use that as being an expert by experience, and then, you know, work in the services. I could go on and go on and go on and go on and go on. I could really hijack this webinar with all the fabulous things that I think.
I know, but it's just, all I can hear is the passion, Claire. And it's so true. Yeah. It is. And it's just exciting just to hear it, because.
And it's not that there's no challenges. Of course there's challenges. There always is, you know what I mean? But what it's great about, sorry, Margaret, but what is great about hearing about all the innovation is that the challenges are being met in one way or another, and, you know, which gives hope for the future for anybody, you know, who needs support around their mental health or well-being going forward.
And you've actually preempted one of the questions that's come in through the audience, Claire, so well done. What do the panel think are the barriers? And this is a really important one, barriers to anything, how do you overcome them? So what are they think the barriers are to innovation in the mental health services? They said there, Mike, I really like the positive risk taking, as you will always learn along the process. So who would like to come in on that? So what are the barriers, number one, and how can you overcome them, number two?
I'll just come in there as well. And I suppose it's when we look at barriers for me for change, and it's like we use a slide here in a lot of our innovation workshops, and it's kind of, and it's only a 3-step cartoon. And the first thing is, who wants change? And there's a big audience there, and all the hands go up. Someone on a podium asks the question. And the second panel is, who wants to change? And you see only a couple of hands go up. And then the third one is, who wants to lead on change? And the audience is gone. You know, so there's something around fear and responsibility where we'll all talk the talk, but something about getting up and doing it. And I suppose for us, if we call it, like, ARIES is going nearly 5 years. And so from the outset, we had to build a brand, we had to build a reputation, we had to be trusted, we had to be seen to be providing something of value within a service, as an example. Whereas now we've reached a point where, you know, as I say, like that positive risk and attitude from senior management, and it's kind of, we're trusted, yeah, go ahead, run webinars, this makes sense. You know, create new courses, meet the needs of our service users and families and staff. If this makes everybody's job easier, this all makes sense. So, and I suppose in simple things like resources would be a big one. You know, it's like Stephanie and saying a new OT going into 5B in Limerick. So again, we'd love to have loads of psychologists, loads of OTs, loads of nurses. And if you gave us double the size of our team, we could do more. And that's probably the barrier. But I suppose it's yeah, it's positive risk taking. Take a chance. You know, what's the worst thing can happen? You know, it's worth it. You know.
And that's it, Mike. It is worth it. And what's fantastic about it is that we can run a webinar like this, and we have lots of people that we can ask, and they'll actually say yes. It's building those trust relationships. And Stephanie, would you like to come in on that?
Yeah, I think it's something that, you know, I suppose was at the forefront of my mind coming on today was how to navigate those barriers, as you said, but something that we try and do a lot of in our department is take students on board. And we find they help connect us back to the research, which, you know, we try and look at so regularly, but they are such a huge asset to us because they can help us on that path to research, and the connections that we have to UL and to other universities in Ireland is so valuable to us to be able to actually, you know, have an extra pair of hands for however much length of time, but someone who's really connected back to research and literature and current and you know, the current evidence base for whatever it is that we're hoping to do. One, you know, it might be a group, for example, or maybe even looking at outcomes and how we can actually measure and scale that and do it in a different way to how it's being done before. So lots of different ways in which we can actually use a resource that's quite close by, but you know, we find that we get a lot from it. But as you say, Mike, there's lots of barriers, but that's one way that we try and work around some of them at least.
I think, Stephanie, you probably have to be creative That's the whole idea with barriers. Think about them in different ways, and maybe if you can't go over it, maybe you can go under it, and maybe you can go around it. So it's just trying to find the right access point. And I think I absolutely agree with you in terms of UL and our relationship there with UL. I don't know if you want to come in with that, Mike, just around the innovation piece, because it's just been great for us.
And Rosemary has her hand up, and I suppose again, yeah, that was a great reminder, Stephanie, about like students. So I suppose we have a great relationship with UL here in Limerick and Mary I as well. And again, it's about meeting future health and mental health professionals. So we give them training pieces on innovation, co-production, and on working in a person-centered way. You know, so it's treat the person, not just the illness or the diagnosis. And we find by the time we get to meet the students, even if they're in fourth year, this is kind of, oh, crikey, I never heard this before. This is brilliant. This makes sense. Co-production, you know, it all makes sense. So again, it's great to have that relationship where you're getting it in here before they're actually out there working as full-time employees in the role. Yeah, Rosemary had her hand up.
Thanks, Mike. Yeah, just Rosemary, if you want to come in there.
Yeah, it follows along. There's both barriers to innovation. Like, we're here on a webinar, and I could be in Donegal or Dublin and still participating, which is brilliant. But for some people, it's difficult, whether it's IT skills or, you know, devices. That we can collaborate a lot online, but there's a connection that happens when you meet in person. So I think, having come out of a period where we couldn't easily connect up, we can appreciate that we have technology skills that we can use to our advantage, and that we do need to get out and meet in person, like gather and share ideas and, you know, form our goals collectively. So I'm delighted that the barrier of not being able to meet in person has broken down, and we're left with an extra kind of online skill.
Absolutely, Rosemary, and it's great having different ways of connecting, but there's very little like actually that face to face and having that opportunity just to, you know, to share and to link in. I suppose I'm just looking at the time there, and I want to kind of get to this, Claire. I will come to you in a second, but I want you to also think about what's coming down the line. I don't want to leave this bit. So, like, this is great what's happening now. There's a couple of things, John, I know you mentioned peer support workers. There's more of them coming online. I know there's some already in post. But what can we expect over the next couple of years in terms of change or innovation, again, that will benefit not just, you know, like service users, but, you know, their families, their supporters, and the community in general? Who would like, Claire, do you want to come in on that one, or did you want to just...
Well, yeah, I suppose like there's a couple that are coming in. I mean, I know that there's in Galway there's a community cafe. It's been piloted and it's been evaluated at the moment, and you know, that is it's looking really, really promising. So, you know, depending on what comes out of the evaluation of that pilot, we could hopefully see those, you know, across country in quite a lot of other communities. And it is that idea of having a cafe where if someone wants to go in and just wants to be someplace, or want to have a chat with somebody, that they have a place to do that. And then, you know, I know that I'm not sure if it's actually happened yet, but, you know, in terms of a crisis response to somebody, you know, who's in distress, that there's, you know, a new ways of actually doing that, which involves like and mental health professionals, the Gardaí and emergency services, so that if they're approaching somebody who's in mental distress, that, you know, there's a more compassionate and more supportive way of supporting that person. That's another pilot that's happened. So there's a lot of different things, and that's only two off the top of my head. I mean, anyone can go on and look at the mental health promotion plan, you know, or Sláinte Care or Sharing the Vision, to see, you know, a lot of the innovative ideas that are planned. And the budget yesterday, like, you know, there was quite a lot of extra funding put aside for that. And sometimes that is the barrier, is resources, not just cash. Sometimes it is about cash, but sometimes it's also about people. So quite a lot of, you know, those smaller, even those larger community organizations in the community need people, need volunteers, you know, people who will use lived experience or who will just turn up, you know what I mean, every Monday, for, you know, to help out and stuff like that, because resources are often scarce. And quite often these organizations have innovative ideas ready to go. They just need the people and the resources to do them. And so if anybody wants to be part of innovation, I would suggest go to your local, you know, community organization, mental health association. People are always looking for volunteers and help out in that way as well. And that's a way that we can support innovation going forward over the next few years as well.
Great, Claire, and it is being part of the change. You know, it's you know, if you want things to change, get involved if you can, if you have the capacity to do so, and whatever that looks like for you. Does anyone else want to come in? That again, looking at the time, John, Rosemary, I'll come to you in a second. I know I haven't come back to you in a while, but again, coming down the road in terms of the acute services, maybe in particular, is there anything there that you think we should know about?
Yeah, well, I think there's more training now being offered to staff, you know, nursing staff here on the unit, like just around, you know, de-escalation technique. A lot of our, you know, work would be around supporting people and kind of identifying their emotions and managing their emotions. And there's DBT training coming up now for staff, so it's like an introduction to DBT, and then you'll be encouraged to go on and further your training in that. And I suppose it'll just kind of educate staff to kind of support I suppose the needs of service users on the unit, you know, around you know, managing their distress and managing their emotions. I think will be an important kind of step forward as well. I know we're obviously going to continue our work with ARIES. I know we're working with you at the moment around creating, I suppose, a physical wellness and healthy eating resources. So that's coming down the line now as well. That's, you know, so it's going to be kind of an extra resource for service users. And, you know, I suppose we go back to that word kind of co-production, like, you know, it's from the, I suppose, the feedback that we've gotten from service users who've attended the self-care, the Let's Talk self-care classes, both in the unit and in the community. And I suppose we kind of identified a need for, you know, maybe putting together some short kind of maybe videos, instruction videos, just to help people become more active, you know, and how to, because a lot of the time people just don't know how to, how to become active, or how to maybe better manage their healthy eating. So just some short videos around maybe how
we're really excited by that.
Yeah.
We're really excited by that, John. I think it's going to be a really great addition to what we're offering. And again, it's something that could be extended to other units if they, you know, so it's fantastic. And we couldn't do that without your vision, you know. I just want to go to, I'm just again looking at the time, and I do want to have time for that signposting piece. So thanks, John. I'm going to go to Rosemary first, and then Mike, I'll finish with you, and then we'll go to some of the signposting, because I want people to have an opportunity to say their goodbyes. And yeah, Rosemary.
Yeah, just another change that's coming down the road under staunch care is more integration of services, where if I attend the GP and that I'm being referred for mental health services, that they'll be available on the same site, you know, so to be a lot more community based and a lot more integrated. And it's just great to hear John speaking about healthy eating and how that, of course, is part of the whole mental health wellness. So they're the kind of positive changes that I could see coming.
Great, Rosemary, thanks for that. And Mike, as I promised, I'll go back to you now.
Yeah, and I suppose as I'm just sitting here and listening to where we talk about challenge, and I suppose a lot of people, and I'm going to say there's a common thread between everybody here today. So when most people are presented with challenge, they see a barrier. Everyone in this room, from the way they've spoken, see an opportunity. And that's the difference. So when we look back through history and all of the people who brought about change, it's people with vision. And the people with vision are present here today. And that's really important. So for me, that's the takeaway, to have that vision that, yes, we can make things better. Simple as. Thanks, Margaret.
Brilliant, Mike. And I think it's a lovely way to press pause and do a bit of signposting. We could be on here for a long time. I think it'd go another 2 hours at least, and we've only scratched the surface. So apologies. And if there's something you really want to share with everybody, please let me know. Because we're just kind of getting into the final parts of it now. And thanks to everybody, the attendees, for sticking with us. I'm just going to share some slides now, and I'll very quickly go through ours, but I do want to pass on to both Michelle and Rosemary just in terms of the signposting piece. So recovery education, in terms of our recovery education workshops, covering everything from anxiety to self-care to building resilience. We've even got family recovery on in October. You can book online on Eventbrite. just look for Mid West ARIES. And we're also, as Rosemary was saying, there's nothing like going back face to face, but we'll always offer both. We're in Carrickconlish in October, and we are in hospital in November, thanks to Ballyhowra development. And also we will be in Ennis with the Women's Shed in November, and in Kilrush in the Lighthouse there in November. Contact me for any of those details later on if that's something you'd be interested in. And also, don't forget, next month, we're looking at, I think it was just the idea of stress, put me off there. Stress, what's that for? Yeah, whole discussion around stress. What is it? What does it look like? And yeah, I leave that one with you, but certainly book online at Eventbrite or send an email to myself, and I'll share those details with you there. Michelle, do you want to just come in and just give a little kind of signposting in terms of yourself?
I will. Okay, so this is our poster that's out in the communities, and really, as I said earlier, you can self-refer by ringing the number. My number is on that, my mobile number and the landline, and it that'll go directly through to myself. And also professionals can refer in people then as well. And I have a referral form. Again, if anyone wants to contact me on my email, I will send them the referral form. And just a reminder again around the inclusion criteria, that anyone in Limerick City over the age of 18 can avail. If they're living in the city, they're over 18, they have the capacity to be able to leave their own home. And then very importantly, then that they're not currently in crisis. If they're currently in crisis, then social prescribing is not the service for them right now. Okay, and also the referrals then can be emailed back to me, or else they can be sent via health mail, or else they can be posted into me here in Paul Partnership. And I suppose to remind people, if they have any questions about the service, that they can contact me directly and I'll be able to answer them.
Brilliant, Michelle, and thank you for that very quick rundown. I just want to mention something that Claire, because again, very innovative. Some new services in this region are all the specialist perinatal mental health team based in Limerick Maternity. Fantastic people run that. The ADHD clinic, this is a pilot program, and the regional hub for women's health based in Nina, which also includes a menopause clinic. So that's some additional some additional kind of innovative work there. There's just loads to go through here, and I'm hoping that we'll get to have another one of these again. Rosemary, would you like to just share a little bit in terms of the forum and how people can get in touch with yourself?
Yeah, this is one of the ways that I'm hoping to engage with people. I took part myself in Limerick originally and was able to contribute there, and I'm now in the responsible role of bringing our forum feedback to the area management team. So this graphic just shows where local forum work feeds up to the area lead. There have been area forum meetings, which we can re-establish, and that local and area management team where decisions are made on the mental health service, and new innovations can be brought forward and decisions made on it. So that's that one with my details there. If anyone is interested, the next one, thanks Margaret, that at a local forum, it's a monthly meeting, a place to speak about our experiences in using mental health service, or someone in our family or support, someone with support. It's a safe place to present our views, and we discuss matters of importance. The main aim is improving services for everyone, and it's something people who participate in the forum would say that to improve the service for young people, or for the next person coming along. That was my motivation myself also. So our purpose is to engage and work in partnership to improve the mental health services. So just that's what I wanted to leave with people: recovery and solution focused. And our next forums will be in Limerick on the 10th of October, in Tipperary the 11th, and in Clare on the 12th. So if people are interested, please contact me.
Thanks, Rosemary. And again, all of these slides, you get a copy of them anyway with the signposting in it if you can't get those details now. But thanks for sharing that, Rosemary, much appreciated. And again, if you want to find Mid West ARIES online, we're obviously across all social media there at Mid West ARIES. Some of our details are there as well in terms of emails. And again, you'll get the slides so you can contact us later. You can listen to this again if this is something you want to do on the wellness panel, and also all of our webinars. And there's some bonus meditations on there from Killian, my colleague there. So definitely check that out. And I'm just going to, one more, couldn't forget, Claire Flynn. Claire's details are there. I'll also mention Mental Health Ireland, always a great website, lots and lots of stuff there to check out. I'm just going to stop that share now, and we're literally at the end, and I just want everybody to, if you can, say a very quick goodbye. I just want to say, first of all, a big thank you to all of you. You've been absolutely brilliant. I really feel that we only scratched the surface, and I'd love to dig deeper. We have got to do this again, and we will. So Claire, if I'll just go around everybody to just want to say their goodbyes. I really appreciate that, Claire.
Yeah, very inspiring. Great to hear of all the amazing work that's continuing. So thanks for having me. I really enjoyed it. Thank you.
Thanks, Claire. Rosemary, do you want to say your goodbyes?
Thank you, Mid West ARIES, for putting this together and getting us talking and thinking about innovation, and yeah, always inspiring. Thank you.
I love that, Rosemary, talking and thinking about innovation. I'm going to keep that one. That's great. John, do you want to say goodbyes there?
Yeah, just great to meet everyone, and great to hear everybody's views on how we can make the mental health service more recovery orientated and within their own areas of work as well. So great to hear from everyone. Thank you.
Brilliant, John, and much appreciate that you came. Stephanie, great to have you here today. Do you want to say your goodbyes?
Yeah, thanks, Margaret, and thanks for inviting me on today. It was really interesting to hear everybody's workplaces and what's going on and what's happening. If anybody who's listening wants to link in with the occupational therapist on their team, that's easy do. You can mention it at your next clinic appointment or whoever your key worker is on the team, and there can always be someone to support you there in that regard. But no, great to be involved today, so thank you very much.
Brilliant, Stephanie, thanks. Michelle, do you want to say goodbye there?
Yeah, thanks, Margaret, and thanks for inviting me on today. As a new service, it was a great opportunity to be involved today. So really enjoyed it. Thanks.
Brilliant, Michelle. And I think we could do a deep dive on each one of these services. I think the webinars are filled for next year, Mike. There's just so much to do for each one. And Mike, if you want to say goodbye there on behalf of ourselves in Mid West ARIES.
And again, I suppose where recovery education is education, but when you look at our approach, it's an adult learning approach where everybody shares their knowledge and experience, and we all have takeaways. And this was a perfect example of, adult education in action here today, because I was really looking forward to, especially, I know I've been working with John, Rosemary for a while, and Claire for ages, along with Margaret, but again, to hear about from Stephanie St. Anne's that approach, and again, the new service only begun in May, Michelle's social prescribing. So again, great things happening. Great stuff. Really enjoyed that. Thank you.
Perfect. And listen, thank you all to the attendees for sticking with it. I'm just going buzzed from this, because this has just been such a positive webinar, and thanks for joining us. I hope to see you again soon. Our next webinar next month is the stress one. Go along to that, and do check us out on YouTube and the wellness panel. Whatever you do today, look after yourselves and have a good one. Take care.